We are in the thick of Chicago's winter snow and ice season. That means emergency rooms are going to be seeing more patients with injuries from trying to deal with conditions. But what can you do to prevent from becoming one of them? We are joined by Dr. Jeremy Alland, a sports medicine physician from Midwestern Orthopaedics at Rush Medicine. Thank you for joining me this morning. Good to have you on.
Yeah, thanks for having me.
Yeah, you guys have a great facility out there. I've been there many times. Okay, but we want to talk about, but not for. Thank goodness it's been for work and not for any injuries. Okay.
Yeah, true.
So we want to talk about people falling. Pretty common this time of year. What would you say is the most common injury that sends people to the emergency room right now?
Yeah, far and away it's falls. We see people falling, because of the slippery conditions, especially with ice and lower visibility. But we also see issues with people shoveling snow. So we'll see overuse strains and also even sometimes heart attacks from people, overexerting themselves.
Yeah, and we haven't had too much horrible weather just yet, but we're starting to get a feel for it. And this year we're dealing with something when it comes to these icy conditions that we're not used to, and that's that most of us are now wearing our masks to protect ourselves from COVID-19. We did an interview a week or so ago with an ophthalmologist who said she has been seeing a lot of people coming in with injuries to their eyes because of the mask throwing their balances off. Is this something that you have experienced in the orthopedic units as well?
Yeah, I think we're definitely starting to see, we've had a few, bad days recently, especially with those freezing rain type situations where we see more ice, we're seeing more falls, and we are encouraging everybody obviously to wear their masks. And in previous years, one of the things we'd always focus on is vision. So cell phones and personal use devices used to be a big issue and still are, where people will walk and be focused on those and lose traction and fall. But same concept would be as with a mask. If the mask is not allowing for clear vision, if somebody can't see an icy area, if they can't see down to their feet as easy, certainly it would increase the risk for a fall. So I would highly encourage continuing to wear the masks, but wearing them in a way that allows you to have clear vision to what you're doing.
Yeah, which is sometimes easier said than done. Okay, so what advice do you have for people, for all of us, so that we can prevent these injuries during this icy and wet season?
Yeah, so for falls, definitely think about traction and visibility. So try to go during the day if you can versus nighttime walking. Wear something on your feet that's going to prevent you from having to slip. Really good traction these times. Dress shoes are sometimes a disaster. Think about not using personal devices and that kind of thing. For things such as shoveling snow, just think about that as being exercise. So if you're somebody who hasn't done a lot of exercise or has a cardiac history, make sure you get clearance from a doctor. If you are going to go out and do that, just make sure that you are doing something to warm up or put yourself in a situation where you're not going from right out of bed to shoveling really heavy snow. If you can do things to sort of warm up as if you were going to go for a run or something like that, it's very helpful. Also think about stretching when you're done, just like you'd done some sort of workout. We always say snow shoveling is another aerobic exercise, and so treat it like that.
Yeah, I know. You're so right about that. A lot of people don't think about it that way, but we learn sometimes the hard way that it is. Dr. Jeremy Alland with Midwest Orthopaedics at Rush, thank you so much for joining me. To have a safe winter season. Nice to talk to you.
Thanks for having me.